going to talk about helminthiasis, also known as infections. The rely to a worm still prescribed medications. These are the first-line treatments recommended worldwide. But in today's video, we'll look at 5 foods that may have slow, supportive effects. They can't replace medicine, but they might help your recovery and support gut health. What is helminthiasis? Helminthiasis is the general name for diseases caused by different parasitic worms. Worm eggs and larvae often enter the body through dirty hands, unwashed fruits and vegetables, contaminated water, or undercooked meat. Most common types: ascariasis, round worms in the intestine, enterobiasis, pinworm, very common in children, teniasis, teniorhynchus, beef or pork tapeworm, echinococosis, dangerous type that affects the liver and other organs. Symptoms and risks. The most common signs include abdominal pain and bloating, fatigue, dizziness, itching around the anus, teeth grinding at night, especially in children, weight loss and appetite changes. If left untreated, worms can cause intestinal blockage, anemia, and serious organ damage. Prevention. The best cure is prevention. Wash hands regularly. Clean fruits and vegetables thoroughly. Cook meat and fish well. Give pets anti-parasitic treatment regularly. Medical treatment. Do not self-medicate. Always take them under medical supervision. Top 5 supportive foods. 1. Papaya seeds. A small study in Nigeria tested papaya seeds mixed with honey on 60 children. Within 7 days, parasite clearance improved from 16.7% to 76.7% with no side effects. Benefits: may slow down the development of worm eggs and larvae. Helps gently cleanse the intestines. With honey can also support immunity. How to use: dried crushed seeds, small amounts about a teaspoon, mixed into yogurt or honey. Caution: not for pregnant women or small children unless approved by a doctor. 2. Pumpkin seeds. Pumpkin seeds contain cucurbitacins, compounds that may paralyze worms, shown mainly in animal and lab studies. Historically used against tapeworms. Benefits: may weaken intestinal worms, provide magnesium, zinc, and healthy fats. High fiber supports bowel movement. How to use: eat 20 to 30 grams of unsalted raw seeds as a snack, traditionally mixed with honey or milk. Overeating may cause digestive discomfort. 3. Probiotic yogurt and kefir worm infections often disturb the gut microbiome. While strong human evidence is lacking, animal studies suggest probiotics may reduce worm burden. Benefits: restore gut flora, strengthen immunity, reduce diarrhea or constipation, support faster gut healing after medication. How to use: 1 cup daily of natural yogurt or kefir with live cultures. No added sugar. Avoid if lactose intolerant or allergic to dairy. 4. Garlic. Garlic contains allicin, which shows anti-parasitic activity in lab and animal studies. Human evidence is limited. Safe in normal food amounts, but large doses may irritate the stomach. Benefits: creates a less friendly environment for worms, improves blood circulation, has antibacterial and antifungal properties. How to use: add 1 to 2 fresh cloves to meals. Some people mix with honey or water. Be cautious if you have stomach ulcers or take blood thinners. 5. Fiber and iron-rich foods. Hookworms especially cause iron deficiency anemia by consuming blood. Fiber helps regulate bowel movements and eliminate waste faster. Benefits: restore iron levels, reduce anemia, support intestinal cleansing. What to eat: red meat, chicken liver, iron. Lentils, beans, chickpeas, spinach, iron plus folate. Carrots, pumpkin, leafy greens, vitamin A plus fiber. Whole grains and fruits, gut support. Increase fiber gradually to avoid bloating. Drink plenty of water. When to see a doctor immediately: if you experience severe abdominal pain, bloody stool, fever, intense itching, blurred vision, or rapid weight loss, do not delay. Seek medical help. Quick recap: today's supportive top 5 foods were 1. Papaya seeds, small human study, positive signs. 2. Pumpkin seeds, lab, animal evidence. 3. Probiotic yogurt, kefir, gut support. 4. Garlic, traditional, some lab evidence. 5. Fiber and iron-rich foods, help against anemia and gut health. Remember, medicine first, food as support. Thank you for watching.
Diarrhea or gastroenteritis. What causes it? How can you treat it? And most importantly, what are the top 5 foods that can help you recover faster? Stay tuned till the end, because these tips are both practical and science-backed. What is gastroenteritis? Gastroenteritis is an inflammation of the stomach and intestines, usually caused by viruses, bacteria, or parasites. Common symptoms include frequent loose stools, stomach cramps, nausea, vomiting, and sometimes fever. The biggest danger is dehydration, so it's important to act quickly. Causes. The most common causes of diarrhea are eating unwashed fruits or vegetables, drinking unsafe water, poor hygiene, and sometimes infections from viruses or bacteria. That's why people often say, dirty hands are the stomach's worst enemy. Symptoms. Main symptoms include frequent watery stools, abdominal pain, nausea and vomiting, sometimes fever and signs of dehydration like dry lips, excessive thirst, and dizziness. If these symptoms get worse, you should see a doctor right away. General treatment advice. The first step in treating diarrhea is replacing lost fluids. Drink plenty of boiled or clean water or oral rehydration solutions, ORS. As for food, keep it light. Avoid fried, fatty, and spicy meals. And now, let's talk about the top 5 foods that can help you recover faster. Top 5 foods. 1. Banana. Bananas are rich in potassium, which the body loses during diarrhea. They also provide quick energy and are gentle on the stomach. No wonder people say, bananas stop diarrhea. There's science behind it. 2. Rice. Rice water or porridge. Rice is one of the best foods for calming the stomach. Rice water or soft porridge helps absorb excess fluid and slows down bowel movements. 3. Chicken broth. Chicken broth not only restores fluids and electrolytes, but also provides easy-to-digest nutrients. In many cultures, giving broth to a sick person is tradition, and modern science agrees it really helps. 4. Toast or plain crackers. Toast or dry crackers are simple, easy to digest, and help absorb some of the fluid in the intestines. They're a classic home remedy for an upset stomach. 5. Probiotic foods, like yogurt or kefir. Yogurt and kefir contain probiotics, good bacteria that restore the natural balance of the gut. Studies show that probiotics can shorten the duration of diarrhea and speed up recovery. Prevention. Prevention is better than cure. Always wash your hands with soap, drink only clean or boiled water, wash fruits and vegetables thoroughly, and for children, vaccination against rotavirus is highly recommended. So, gastroenteritis or diarrhea can be unpleasant and sometimes dangerous, but with the right foods and proper care, you can recover quickly. Remember, stay hydrated, eat light, and keep good hygiene. What is diabetes? Diabetes is a long-term condition. It happens when your body doesn't make enough insulin or when your cells don't use insulin properly. As a result, sugar builds up in the blood. Types of diabetes. There are 3 main types. Type 1, common in children and young people. The body makes no insulin, so daily insulin is needed. Type 2, common in adults. The body makes insulin, but cells don't respond to it. This is called insulin resistance. Gestational diabetes happens during pregnancy, often temporary, but increases the risk of type 2 later. Main symptoms: feeling very thirsty, frequent urination, feeling tired, losing or gaining weight quickly, blurred vision, slow healing wounds. Complications. If diabetes is not controlled, it can lead to serious health issues such as cardiovascular diseases, kidney failure, eye problems, even blindness, nerve damage, neuropathy, foot ulcers, and gangrene. Treatment. For type 1 diabetes, insulin therapy is required. For type 2, healthy diet, exercise, medication, and sometimes insulin. The most important rule: check your blood sugar regularly. Healthy eating recommendations: eat more vegetables and leafy greens, whole grains, oats, brown bread, buckwheat, lean meats and fish, nuts and legumes, fruits in moderation. Avoid white bread, sweets, and sugary drinks. Remember, nutrition is the strongest weapon in controlling diabetes. Now let's explore the top 5 foods that help fight diabetes. Top 5 foods. 1. Vegetables and leafy greens. Vegetables like broccoli, spinach, and cabbage are rich in fiber and vitamins. Broccoli contains sulforaphane, which helps lower blood sugar. They also protect the heart and keep you full for longer. 2. Nuts. Almonds, walnuts, and pistachios are excellent sources of healthy fats and protein. They improve insulin sensitivity and reduce bad cholesterol. Studies show that eating just a handful of nuts daily helps control diabetes. 3. Fatty fish. Salmon, sardines, and mackerel are rich in omega-3 fatty acids. They protect the heart, reduce inflammation, and improve blood circulation. It's recommended to eat fish at least twice a week. 4. Whole grains. Oats, buckwheat, and brown rice are high in complex carbs and fiber. They raise blood sugar slowly and help maintain stable levels. Replacing white bread and pasta with whole grain options is the healthiest choice. 5. Avocado. Avocado is packed with healthy fats, potassium, and fiber. It improves insulin sensitivity and supports heart health. Regular avocado consumption is especially beneficial for type 2 diabetes. Conclusion: diabetes is difficult to cure completely, but with the right diet and lifestyle, it can be effectively managed. Remember, vegetables, nuts, fatty fish, whole grains, and avocado are your best helpers in the fight against diabetes.
We're going to talk about a very important topic: dementia. This is not just normal aging, but a condition that affects memory, thinking, and daily life. There is no complete cure yet, but here's the good news. Science shows us that certain lifestyle choices and specific foods can help slow down dementia. So let's begin by understanding what dementia really is and how widespread it has become. What is dementia? Key facts and statistics. Dementia is not a single disease, but a group of symptoms that affect memory, language, reasoning, and decision-making. The most common cause is Alzheimer's disease, which accounts for 60 to 70% of all cases. Today, more than 57 million people worldwide are living with dementia, and by 2050, this number is expected to more than double. But here's a hopeful fact. About 40 to 45% of dementia risk can be reduced through lifestyle changes. So what does modern science say about prevention? Let's look at some of the latest discoveries. Scientific discoveries. Recent studies reveal fascinating insights. Leafy greens like spinach improve blood flow in the brain. Nuts and dairy products support cognitive function. People with a strong sense of purpose in life have up to 28% lower risk of dementia. Even with genetic risks, following a Mediterranean diet can cut the risk by 30 to 35%. Clearly, nutrition plays a central role. Now, let's dive into the top 5 foods that science says are most effective against dementia. Top 5 foods to slow down dementia. 1. Fatty fish, salmon, mackerel, sardines, rich in omega-3 fatty acids that protect brain cells and reduce inflammation. A Harvard study found that people who ate fish once a week had a 20% lower risk of dementia. Tip: Eat fatty fish once or twice a week, preferably grilled or baked. But fish alone isn't enough. The brain also needs the power of leafy greens. 2. Leafy greens: spinach, kale, lettuce. Packed with lutein, folate, and vitamin K that support brain blood vessels. A Rush University study found that people who ate greens daily had brain function 11 years younger than those who didn't. Tip: add leafy greens to salads, smoothies, or side dishes daily. Greens are powerful, but when it comes to protecting memory, nothing beats berries. 3. Berries: blueberries, strawberries, raspberries, high in flavonoids and anthocyanins, which boost memory and brain circulation. A 20-year Harvard study found that women who ate berries regularly perform better on memory tests. Tip: enjoy fresh or frozen berries 2 to 3 times per week. Berries strengthen memory, while the next food, olive oil, helps protect the brain from inflammation. 4. Extra virgin olive oil. Rich in polyphenols and antioxidants, it reduces brain inflammation. An Italian study found that consuming just 1 tablespoon per day lowered Alzheimer's risk by 30%. Tip: use olive oil for salads and dressings, but avoid frying with it. And finally, one of the most powerful brain protectors: nuts and seeds. Einde, nuts and seeds, walnuts, almonds, chia, flax. Great source of vitamin E, polyphenols, and plant-based omega-3. A 2019 study found that people who ate nuts 5 times a week had a 25% lower risk of cognitive decline. Tip: eat a handful of nuts daily, as a snack or in salads and breakfast. Summary: so, these 5 foods, fatty fish, leafy greens, berries, olive oil, and nuts, form the core of a brain protective diet. But how do we put them all together in a balanced plan? The answer lies in the MIND diet. The MIND diet. The MIND diet is a combination of the Mediterranean and DASH diets created specifically for brain health. It emphasizes leafy greens, berries, nuts, whole grains, olive oil, and fish. Studies show that following the MIND diet can reduce dementia risk by 25 to 50%. But diet alone is not enough. Let's now look at the lifestyle habits that also protect the brain. Lifestyle factors. Apart from diet, lifestyle is critical. Regular exercise improves circulation and supports new brain connections. Reading, learning new skills, or playing strategy games strengthens brain reserves. Social activity reduces stress and improves mood. Controlling blood pressure and cholesterol lowers dementia risk. So when we combine healthy eating with an active lifestyle, we build a much stronger defense against dementia. Future approaches and conclusion. Scientists are working on personalized prevention, combining genetics, nutrition, and lifestyle to fight dementia more effectively. To sum up, dementia may not be completely curable, but we can definitely slow it down. The top 5 brain-boosting foods: fatty fish, leafy greens, berries, olive oil, and nuts are your strongest allies. Add these to your diet, stay physically active, keep learning, and maintain strong social connections. Ischemic heart disease, IHD. This condition happens when the heart muscle doesn't get enough blood and oxygen. In fact, it is one of the leading causes of death worldwide. In this video, we'll explore causes, types, symptoms, risk factors, treatment and prevention, and finally, the top 5 foods that can slowly heal and protect your heart. Main causes. The biggest cause of IHD is atherosclerosis, fatty plaques made of cholesterol, fats, and calcium that build up inside arteries. Over time, these plaques narrow the arteries, reducing blood flow. If a plaque bursts, a blood clot can completely block the artery, causing a heart attack, myocardial infarction. Types of ischemic heart disease. IHD can appear in different forms: stable angina, chest pain during activity, rest, unstable angina, chest pain even at rest, dangerous sign of heart attack, when supply is cut off, heart cells die, heart failure, lung damage weakens pumping ability. Symptoms: knowing this early can save lives. Chest pain or often spreading to neck or jaw, shortness of breath, fatigue, weakness, irregular beat, dizziness, sweating, nausea. In women and older adults, symptoms may be more subtle. Risk factors: the major risks include smoking, high blood pressure, high cholesterol, diabetes, obesity, lack of exercise, chronic stress, family history plus age. The good news: many of these can be controlled with lifestyle changes. Treatment has three main parts: lifestyle changes, quit smoking, exercise, eat healthy, reduce stress. Medications: aspirin, beta blockers, statins, nitrates. Procedures: stenting or bypass surgery to restore blood flow. But remember, prevention is better than treatment. Prevention: protect your heart every day. Eat more fruits and vegetables. Exercise 150 minutes per week. Monitor blood pressure, sugar, cholesterol. Maintain healthy weight. Sleep well and reduce stress. And now, 30% stabilizes heartbeat and lowers blood pressure. Prevents dangerous blood clots. Eat fish 2 to 3 times per week, or consider omega-3 supplements, doctor approved. 2. Olive oil. Mediterranean Secret Extra Virgin Olive Oil equals heart's best friend. Mediterranean diet with olive oil cut heart risk by 30%. Lowers bad LDL cholesterol, raises good HDL cholesterol, protects arteries with antioxidants. Use raw in salads, not for frying. 3. Nuts, nature's medicine. Almonds, walnuts, pistachios, cashews. Reduce heart risk by 20 to 25%. Improve cholesterol balance. Keep blood vessels flexible and strong. A small handful 4 to 5 times a week is perfect, but avoid overeating. 4. Legumes plus vitamin C. Perfect combo: beans, chickpeas, lentils, peas high in iron, folate, plant protein, but iron absorbs poorly until paired with vitamin C. Tomatoes, peppers. Strengthens heart muscle, improves blood circulation, boosts nutrient absorption. Add lemon juice to lentil soup or combine beans with tomatoes and peppers. 5. Fruits and vegetables. Natural Shield, spinach, broccoli, carrots, oranges, berries. Harvard study: 5 servings per day equals 25 to 30% lower heart disease risk. Potassium lowers blood pressure. Vitamin C and folate strengthen the heart. Antioxidants protect arteries. Eat rainbow colors daily: green, red, orange, yellow, purple. Final thoughts: these 5 superfoods won't replace medicines, but they will slow disease progression, reduce symptoms, strengthen your heart, help you live longer and healthier. Take care of your heart. It's the engine of your life. We'll talk about a very important topic: bronchial asthma. Asthma is a chronic respiratory disease where the airways become inflamed and narrowed, making it difficult to breathe. Coughing, chest tightness, and wheezing are some of the main symptoms. Although asthma cannot be completely cured, it can be controlled, allowing people to live a full and active life. First, let's understand how asthma develops. Then we'll discuss its symptoms, triggers, and treatment options, which will make it easier to manage. How does asthma develop? 2 main factors play a role in asthma. 1. Genetic factors. If asthma or allergies run in the family, the risk is higher. 2. Environmental factors. Dust, polluted air, smoke, and infections. People with asthma have sensitive airways that narrow easily, even from minor triggers. Knowing the symptoms and avoiding triggers can greatly improve quality of life. Main symptoms of asthma. Asthma usually appears with the following signs: shortness of breath, wheezing or noisy breathing, persistent dry cough, often at night or in the morning, chest tightness or pressure, symptoms worsening after exercise or exposure to allergens. As you can see, these symptoms can make daily life challenging. Recognizing and treating them is crucial. Asthma common triggers include allergens, dust, pollen, pet hair, mold infections, cold, flu, bronchitis, environmental factors, cold air, smoke, pollution, physical activity, running or intense exercise, stress and emotional strain, certain medications, aspirin, beta blockers. Once we know the triggers, we can also look at different types of asthma, since treatment and prevention vary. Types of asthma. Asthma can occur in different forms. 1. Allergic asthma. 2. Non-allergic asthma. 3. Childhood asthma. 4. Adult onset asthma. 5. Occupational asthma. Knowing the type helps doctors plan treatment and advise on avoiding triggers. Severity of asthma. Asthma can be mild, moderate, or severe. Mild symptoms appear rarely. Moderate, frequent shortness of breath, especially at night. Severe symptoms occur almost daily, requiring more medications. Understanding severity helps in managing asthma and knowing what to do during an attack. How is asthma diagnosed? Doctors diagnose asthma using patient complaints and medical history. Spirometry measures lung volume and airflow. Peak flow meter monitors lung function and attacks. Allergy tests identify triggers. Once diagnosed, the next step is treatment and lifestyle management. Treating asthma. Even though asthma cannot be fully cured, it can be controlled. 1. Medications. Rescue inhalers for immediate relief during attacks. Long-term medications reduce inflammation and prevent attacks. 2. Lifestyle management. Avoid allergens, quit smoking, maintain cleanliness at home, regular moderate exercise, healthy diet and stress management. During an asthma attack. 1. Stay calm and don't panic. 2. Use a rescue inhaler. 3. If symptoms persist, call your doctor or emergency services. Correct action during an attack can save your life. Preventing asthma. Avoid dust and allergens. Protect yourself from colds and flu. Regular checkups with your doctor. Maintain a healthy lifestyle. Next, let's look at foods that help and harm asthma, because diet can also ease symptoms. Beneficial foods for asthma. Foods that expand airways, reduce inflammation, and boost immunity. Green vegetables, broccoli, spinach, fish, salmon, sardines, mackerel, apples, protect lungs with quercetin and vitamin C. Citrus fruits, rich in vitamin C and bioflavonoids. Nuts and seeds, sources of omega-3 and magnesium. Garlic and onion, natural antibiotics. Ginger, relaxes airways. Sweet potatoes, beta-carotene and vitamin A. Avocado, legumes, bananas, berries, milk and yogurt. Turmeric. These foods protect airways, reduce inflammation, and strengthen immunity. Harmful foods for asthma. Some foods can worsen asthma symptoms. It is red meat, sweets and white flour products, fatty dairy, fried foods and fast food, soda and energy drinks, alcohol, sausages and processed meats, chocolate and caffeinated products, tobacco smoke. The most dangerous factor, harmful foods narrow airways, trigger allergies, and increase attack risk. Of course, proper nutrition plays an important role in reducing asthma symptoms. Let's take a closer look at the top 5 natural products beneficial for asthma and their benefits. Top 5 natural foods for asthma. 1. Apples. Key nutrients, flavonoids, quercetin, vitamin C, fiber. Benefits. Quercetin reduces inflammation in the lungs. Vitamin C protects airways from free radicals. Studies show regular apple eaters have fewer asthma symptoms. Extra benefit boosts immunity and helps fight allergies. Apples are considered a natural remedy for protecting the respiratory tract and reducing inflammation. Therefore, it is recommended to include them in a regular diet for those struggling with asthma. 2 citrus fruits. Key nutrients: vitamin C, bioflavonoids, potassium. Benefits: reduce lung inflammation and strengthen airways, minimize allergic reactions, help prevent attacks triggered by cold or infections. Extra benefit: boosts overall immunity. It supplies the body with vitamins and increases overall immunity. Therefore, fruits like oranges, lemons, and grapefruits are beneficial for respiratory health. 3. Garlic and onion. Key nutrients: sulfur compounds, allicin, flavonoids. Benefits: strong anti-inflammatory effect, open airways and reduce bronchial spasms, thin mucus for easier clearance. Extra benefit: fight infections and prevent asthma triggered by colds. Adding garlic and onions to daily meals naturally helps reduce asthma attacks. 4. Ginger. Key nutrients: gingerol, shogal, essential oils. Benefits: relax bronchial muscles and widen airways, reduce inflammation and ease symptoms, thin mucus and relieve cough. Extra benefit: strengthens immunity and helps during colds and flu. Adding ginger to tea or mixing it in dishes can be effective in fighting asthma. 5. Sweet potatoes. Key nutrients: beta-carotene, vitamins A and C. Benefits: beta-carotene converts to vitamin A, protecting lung lining, reduces airway sensitivity and allergic reactions, powerful antioxidant to reduce inflammation. Extra benefit: supports immunity and balances blood pressure. Sweet potatoes are very beneficial for people with asthma as a natural anti-inflammatory product that protects the respiratory tract. Summary: apples and citrus, rich in vitamin C, protect lung cells. Garlic and onion, natural antibiotics, open airways. Ginger widens bronchi, eases mucus. Sweet potatoes, vitamin A and beta-carotene strengthen lung lining. General conclusion: asthma is a chronic but controllable disease. Even though it cannot be completely cured, with the right treatment, lifestyle changes, and healthy nutrition, people with asthma can live a normal, active, and fulfilling life. Knowing the symptoms and triggers helps prevent severe attacks. Medications and inhalers provide effective control. A healthy diet with apples, citrus fruits, garlic, ginger, and sweet potatoes can reduce inflammation and protect the lungs. Avoiding harmful foods, smoking, and pollution is equally important. In short, with proper care, asthma does not have to limit your life. It can be managed successfully. An issue that affects millions of lives and concerns many people: obesity. Did you know that in recent years, 1 out of every 3 people has been diagnosed as overweight? Obesity is not just about appearance. It poses serious risks to the heart, the liver, and the entire body. If you also dream of living a healthy and active lifestyle, make sure to watch this video until the end. Let's take a closer look at this problem together. We'll show you the causes of obesity, its consequences, and the most effective ways to overcome it. Obesity is not just simple weight gain. It is a serious disease caused by excessive fat accumulation in the body. To diagnose it, we use the Body Mass Index, or BMI. If BMI is between 18.5 and 24.9, normal weight. Between 25 and 29.9, overweight. 30 and above, it's considered a obesity. The main cause of obesity is energy imbalance. This means that when the calories consumed are greater than the calories burned, the body starts storing fat. But this process is not only linked to food. A sedentary lifestyle, genetic predisposition, hormonal changes, stress, and lack of sleep can all contribute to obesity. For example, frequent consumption of fast food, sugary drinks, and fatty meals leads to weight gain. At the same time, sitting for long hours in front of a computer or television without physical activity accelerates this process. Obesity causes serious harm to the body. First of all, it puts a huge strain on the cardiovascular system, increasing the risk of hypertension, ischemic heart disease, stroke, and heart attack. It is also one of the leading causes of type 2 diabetes. Additionally, obesity is linked to liver disease, joint problems, sleep apnea, and even certain types of cancer. That's why obesity should not be considered just a matter of appearance. It is a dangerous disease that affects the overall health of the body. Now comes the main question: how can obesity be treated? Experts recommend 3 essential steps. The first step, control your diet. The second step, regular physical activity. The third step, behavioral therapy. The role of nutrition in treating obesity. The very first and most important step in managing obesity is controlling your diet. This is because the main reason behind excess weight is consuming more calories than the body actually needs. 1. Fiber-rich foods. Vegetables, fruits, whole grains, and legumes are excellent sources of fiber. Fiber stays in the stomach longer and prolongs the feeling of fullness. For example, eating a bowl of vegetable salad or an apple will fill you up more than a dessert, but with far fewer calories. This method reduces overall calorie intake and helps with weight control. 2. Protein-rich foods. Protein helps preserve muscle mass while also boosting metabolism. Getting enough protein is crucial during weight loss because losing muscle mass can slow down metabolism. Chicken, fish, eggs, yogurt, and legumes are recommended sources of protein. For instance, instead of having bread and tea for breakfast, choosing an egg salad or yogurt is not only healthier, but also keeps hunger away for longer. 3. Avoiding processed foods. Sugary drinks, fast food, processed meals, and sweets are digested quickly, enter the bloodstream rapidly, and spike insulin levels. This leads to hunger returning sooner. Such foods provide lots of calories in a short time, but lack essential nutrients. That's why it is better to limit them and replace them with natural, home-cooked meals. 4. Increasing water intake. Many people confuse thirst with hunger. Drinking enough water is essential to control appetite and improve the body's metabolic processes. It is recommended to drink at least 1.5 to 2 liters of water daily. Sugary drinks, on the other hand, actually contribute to weight gain. 5. Eating pattern. Having a regular and balanced eating schedule plays a huge role in treating obesity. Staying hungry for a long time and then overeating puts the body under stress and promotes fat storage. That's why experts recommend 3 main meals and 2 small snacks per day for healthier weight management. Now, let's take a look at the top 5 most beneficial foods against obesity. Top 5 foods to fight obesity. 1. Leafy green vegetables, spinach, broccoli, kale, lettuce. Leafy greens are among the best allies in the fight against obesity. They are very low in calories but packed with vitamins A, C, K, minerals, calcium, magnesium, iron, and antioxidants. Most importantly, their high fiber content slows down digestion and keeps you feeling full for longer. For example, adding spinach or broccoli salad to your breakfast or dinner can significantly reduce hunger. Leafy greens also help regulate blood sugar levels, and research shows that people who consume them regularly lose weight faster and improve their metabolism. 2. Legumes, beans, chickpeas, lentils, mung beans. Legumes are among the richest natural sources of protein and fiber. Protein strengthens muscles, while fiber improves digestion and suppresses appetite. A bowl of cooked beans or lentils is not only filling, but also provides long-lasting energy. Legumes contain slow-digesting carbohydrates, which do not cause a rapid spike in blood sugar and help maintain stable insulin levels. That's why legumes are also highly beneficial in preventing diabetes. Nutrition experts recommend including them in your diet at least 2 to 3 times per week. 3. Eggs. Eggs are simple, affordable, and incredibly nutritious. One egg contains about 6 grams of protein, along with vitamin D, vitamin B12, folate, and other essential nutrients. Eating eggs for breakfast is especially beneficial. The protein keeps you full and helps prevent overeating throughout the day. Studies show that people who eat eggs for breakfast consume fewer calories during the rest of the day compared to those who eat other types of breakfast. In addition, eggs contain choline, a nutrient that supports brain function and is important for a healthy metabolism. 4. Apples and pears. Apples and pears are among the best natural sweet snacks for weight management. They are rich in fiber, vitamin C, antioxidants, and other essential compounds. A key benefit is their high content of pectin, a special type of fiber that slows digestion, stabilizes blood sugar levels, and enhances the feeling of fullness. For example, choosing an apple instead of a piece of cake means fewer calories and longer satiety. Moreover, apples and pears improve heart health and reduce fat absorption in the digestive system. 5. Water. Water is the simplest and most effective medicine for weight control. Many people mistake thirst for hunger. Drinking a glass of water before meals reduces appetite and leads to lower calorie intake. Water also improves digestion, removes toxins, and boosts metabolism. Research shows that people who drink at least 1.5 to 2 liters of water daily lose more weight than those who don't. On the other hand, sugary drinks only increase the risk of weight gain. That's why choosing plain water as your primary drink is crucial in both treating and preventing obesity. In conclusion, changing eating habits is the most important step in treating obesity. The foods we discussed, leafy greens, legumes, eggs, apples and pears, and of course water, are your strongest allies. They not only help reduce weight, but also improve overall health, provide energy, and support a healthier body. Physical activity. The second key step against obesity. When it comes to treating obesity, it's not only about diet. Physical activity plays an equally important role. Exercise helps burn excess calories, maintain muscle mass, and boost metabolism. How much exercise is needed? Experts recommend at least 150 minutes of moderate intensity exercise per week. This can be done as 30 minutes a day, 5 days a week. If you want to lose weight faster, you can increase this amount to 300 minutes per week. What types of exercise are most effective? 1. Cardio exercises, activities that increase your heart rate, such as brisk walking, running, cycling, swimming, Zumba, or dance workouts. These exercises burn a lot of calories and strengthen the cardiovascular system. 2. Strength training, exercises that build and maintain muscle, such as weightlifting, squats and push-ups, resistance band workouts, pull-ups, and body weight training. Strength training increases muscle mass. Since muscles burn more energy than fat, they speed up metabolism, meaning you burn more calories even at rest. Benefits of regular exercise: helps reduce excess weight, normalizes blood pressure, lowers the risk of type 2 diabetes, improves mood and sleep quality, strengthens heart and lung function, boosts overall immunity. How to get started. If you're new to exercise, don't jump straight into heavy workout routines. Start with 15 to 20 minutes of walking daily. Gradually add jogging, cycling, or swimming. After a few weeks, you can also introduce strength training. Conclusion: physical activity is one of the most important steps in treating obesity. It doesn't just reduce weight, it improves overall health, enhances quality of life, and gives you more energy. The key is to stay consistent and make exercise a part of your daily lifestyle. The third step against obesity: behavioral therapy. In treating obesity, it's not only about diet and exercise. A person's behavior and daily habits also play a very important role. That's why experts recommend behavioral therapy as one of the most effective methods against obesity. 1. Keeping a food and exercise journal. Writing down what you eat throughout the day is very helpful. Studies show that people who track their daily food intake lose twice as much weight compared to those who don't. When you know exactly what you're eating, it's easier to control excess calorie consumption. Tracking your physical activity also boosts motivation. Cure 2. Self-monitoring. One of the most important steps in fighting obesity is regular self-checking. Weighing yourself once a week, monitoring your body mass index, and even noticing how your clothes fit. All of this encourages change and shows real progress. 3. Managing stress. Stress is one of the hidden causes of obesity. During stress, the body produces more cortisol, a hormone that increases appetite and cravings for sugary or fatty foods. As a result, people eat more and gain weight. To reduce stress, methods such as meditation, yoga, breathing exercises, or simply walking in nature can be very effective. 4. Quality sleep. Scientific studies show that people who don't get enough sleep produce more ghrelin, the hunger hormone, and less leptin, the satiety hormone. This leads to overeating. Getting 7 to 8 hours of quality sleep not only improves mood, but also plays a crucial role in weight control. 5. Psychological support. Sometimes it's difficult to lose weight alone. That's why having support from friends, family members, or special support groups makes success much easier. A positive environment and motivation increase patience and consistency. As conclusion, behavioral therapy is the third and very important step in treating obesity. Keeping track of food, self-monitoring, reducing stress, and getting enough sleep all accelerate weight loss and help achieve long-term results. In some cases, doctors may prescribe weight loss medications, but only under professional supervision. In severe cases of obesity, bariatric surgery, such as stomach reduction or intestinal bypass, may be considered. However, the best method is prevention. Teaching children healthy eating habits, encouraging regular physical activity, and promoting a healthy lifestyle within the family are the most effective preventive measures. In short, obesity is a serious disease, but it can be overcome. With healthy nutrition, regular exercise, psychological support, and medical help if needed, anyone can achieve positive results. Today, we are talking about a health issue that affects millions of people worldwide: allergies. Why do they occur? What are the symptoms and possible complications? And how can we manage and treat them? Let's find out together. What is an allergy? An allergy is when the immune system reacts abnormally to substances that are normally harmless, such as dust, pollen, pet dander, or certain foods. In people without allergies, these substances cause no problem, but in sensitive individuals, they trigger various symptoms. What causes allergies? Allergens. The substances that trigger allergies are called allergens. The most common include pollen, especially in spring and summer, house dust and dust mites, pet dander and hair, food allergens, milk, eggs, nuts, fish, shellfish, medications, penicillin, aspirin, antibiotics, insect stings, bees, wasps, mosquitoes, chemical substances, perfumes, cleaning products. Symptoms of allergies. Allergies affect different organs and may cause respiratory system, runny nose, congestion, sneezing, coughing, shortness of breath, eyes, redness, itching, watery eyes, skin itching, rashes, eczema, redness, digestive system, stomach pain, diarrhea, nausea, severe cases, anaphylactic shock, breathing difficulty, drop in blood pressure, loss of consciousness. Complications of untreated allergies. If left unmanaged, allergies can lead to bronchial asthma, chronic inflammation of the airways, chronic sinusitis and nasal polyps, constant congestion and headaches, atopic dermatitis and eczema, persistent skin inflammation, food allergy complications, gastritis, malnutrition, digestive disorders, anaphylactic shock, the most dangerous complication, life-threatening without emergency treatment. Diagnosing allergies, skin tests, allergens applied to or injected under the skin, blood tests, measuring immunoglobulin E, IgE, provocation tests, allergen exposure under medical supervision. Prevention strategies. Always read food labels carefully. Reduce carpets and soft toys at home. Use air filters and humidifiers. Enjoy fresh air, but avoid outdoor activity during pollen season. Treatment options 1. Avoiding allergens. The most important step is avoiding the trigger. Example: if allergic to pollen, keep windows closed and limit outdoor time during spring. For dust allergies, reduce carpets, wash bedding regularly, clean with damp cloths. For food allergies, completely avoid trigger foods. 2. Medications. Antihistamines, loratadine, cetirizine, fexofenadine, reduce itching, runny nose, rashes. Nasal sprays and corticosteroids, relieve nasal congestion. Bronchodilators, open airways in asthma-like symptoms. Eye drops, soothe itchy and red eyes. 3. Emergency treatment. In anaphylactic shock, immediate injection of epinephrine, adrenaline, is life-saving. People with severe allergies should always carry an epinephrine autoinjector. 4. Immunotherapy, allergy vaccines. Small increasing doses of allergens are given over time. Goal: train the immune system to tolerate allergens. Treatment takes months or years, but can be very effective. 5. Lifestyle changes. Keep your home clean and dust-free. Change clothes and wash your face after being outdoors in pollen season. Avoid trigger foods and keep antihistamines on hand. Preventive measures. Regularly clean dust at home and wash carpets. Spend less time outdoors during pollen season. People with animal allergies should keep their distance from cats and dogs. If you have a food allergy, carefully read product labels. Always keep an antihistamine medication with you. Natural remedies and home care. 1. Honey. Local honey contains natural enzymes, vitamins B, C, minerals, flavonoids, and trace pollen. Helps the body gradually adapt to pollen, reducing immune overreaction. Studies show honey reduces runny nose, sneezing, and throat irritation. Not safe for infants under 1 year. Risk of botulism. 2. Ginger. Active compounds, gingerol shogal, are natural anti-inflammatories. Reduce airway inflammation, ease breathing, decrease histamine release. Can be consumed as tea, fresh root in meals, or dried powder. 3. Vitamin C-rich foods. Powerful antioxidant, lowers histamine levels. Eases sneezing, congestion, watery eyes. Found in citrus fruits, kiwi, strawberries, broccoli, spinach, parsley. Daily 200 milligrams vitamin C shown to relieve allergy symptoms. 4. Green tea. Contains quercetin and catechins that lower histamine release. Relieves nasal congestion, eye irritation, supports immunity. Expands airways, improves breathing. Best, 1 to 2 cups daily. 5. Probiotics. Gut health is directly linked to immune health. Yogurt, kefir, kimchi restore gut flora and strengthen immunity. Reduce food allergies, atopic dermatitis, asthma in children. 6. Home practices. Nasal rinse with saline. Removes allergens and clears nasal passages. Humidifiers prevent dryness and reduce irritation. Regular cleaning, vacuum, wash bedding weekly, reduce dust. Air filters capture pollen and dust, useful in spring/summer. Change clothes and shower after coming home from outside. Conclusion: honey, ginger, vitamin C-rich products, green tea, probiotics, and simple home remedies significantly reduce allergy symptoms and complications. They support the immune system and make the body resistant to allergens. Daily routine for managing allergies naturally. Morning: 1 teaspoon honey in warm water, tea before breakfast. Fresh fruits or lemon water, vitamin C boost. Midday: 1 to 2 cups green tea, ginger tea, or add fresh ginger to meals. Evening: probiotics, yogurt, kefir, kimchi, with or after dinner. Daily home care: saline nasal rinse 1 to 2 times daily. Use humidifier at night. Keep home clean and wash bedding weekly. Conclusion: to reduce allergies through natural methods, follow the following simple procedure. Morning: honey plus fruits rich in vitamin C. Daytime: green tea plus ginger. Evening: probiotics. Every day: rinse the nose, monitor air humidity, observe home hygiene. If you make this a habit, the symptoms of allergies will gradually subside and immunity will be strengthened. Exercises that ease allergy symptoms. 1. Breathing exercises. Diaphragmatic breathing reduces shortness of breath. Buteyko method helps with asthma-like symptoms. 2. Nasal exercises. After saline going to talk about helminthiasis, also known as worm infections. Quick warning: the most reliable way to eliminate worms is still with doctor-prescribed medications. These are the first-line treatments recommended worldwide. But in today's video, we'll look at 5 foods that may have slow, supportive effects. They can't replace medicine, but they might help your recovery and support gut health. What is helminthiasis? Helminthiasis is the general name for diseases caused by different parasitic worms. Worm eggs and larvae often enter the body through dirty hands, unwashed fruits and vegetables, contaminated water, or undercooked meat. Most common types: ascariasis, round worms in the intestine; enterobiasis, pinworms, very common in children; tiniasis, teniarhynchus, beef or pork tapeworm; echinococosis, dangerous type that affects the liver and other organs. Symptoms and risks. The most common signs include abdominal pain and bloating, fatigue, dizziness, itching around the anus, teeth grinding at night, especially in children, weight loss and appetite changes. If left untreated, worms can cause intestinal blockage, anemia, and serious organ damage. Prevention. The best cure is prevention. Wash hands regularly. Clean fruits and vegetables thoroughly. Cook meat and fish well. Give pets anti-parasitic treatment regularly. Medical treatment. Do not self-medicate. Always take them under medical supervision. Top 5 supportive foods. 1. Papaya seeds. A small study in Nigeria tested papaya seeds mixed with honey on 60 children. Within 7 days, parasite clearance improved from 16.7% to 76.7% with no side effects. Benefits: may slow down the paralyzed worms, shown mainly in animal and lab studies. Historically used against tapeworms. Benefits: may weaken intestinal worms, provide magnesium, zinc, and healthy fats. High fiber supports bowel movement. How to use: eat 20 to 30 grams of unsalted raw seeds as a snack, traditionally mixed with honey or milk. Overeating may cause digestive discomfort. 3. Probiotic yogurt and kefir worm infections often disturb the gut microbiome. While strong human evidence is lacking, animal studies suggest probiotics may reduce worm burden. Benefits: restore gut flora, strengthen immunity, reduce diarrhea or constipation, support faster gut healing after medication. How to use: 1 cup daily of natural yogurt or kefir with live cultures. No added sugar. Avoid if lactose intolerant or allergic to dairy. 4. Garlic. Garlic contains allicin, which shows anti-parasitic activity in lab and animal studies. Human evidence is limited. Safe in normal food amounts, but large doses may irritate the stomach. Benefits: creates a less friendly environment for worms, improves blood circulation, has antibacterial and antifungal properties. How to use: add 1 to 2 fresh cloves to meals. Some people mix with honey or water. Be cautious if you have stomach ulcers or take blood thinners. 5. Fiber and iron-rich foods. Hookworms especially cause iron deficiency anemia by consuming blood. Fiber helps regulate bowel movements and eliminate waste faster. Benefits: restore iron levels, reduce anemia, support intestinal cleansing. What to eat: red meat, chicken liver, iron; lentils, beans, chickpeas, spinach, iron plus folate; carrots, pumpkin, leafy greens, vitamin A plus fiber; whole grains and fruits, gut support. Increase fiber gradually to avoid bloating. Drink plenty of water. When to see a doctor immediately: if you experience severe abdominal pain, bloody stool, fever, intense itching, blurred vision, or rapid weight loss, do not delay. Seek medical help. Quick recap. Today's supportive top 5 foods were: 1. Papaya seeds, small human study, positive signs. 2. Pumpkin seeds, lab, animal evidence. 3. Probiotic yogurt, kefir, gut support. 4. Garlic, traditional, some lab evidence. 5. Fiber and iron-rich foods, help against anemia and gut health. Remember, medicine first, food as support. Thank you for watching.
Diarrhea or gastroenteritis. What causes it? How can you treat it? And most importantly, what are the top 5 foods that can help you recover faster? Stay tuned till the end, because these tips are both practical and science-backed. What is gastroenteritis? Gastroenteritis is an inflammation of the stomach and intestines, usually caused by viruses, bacteria, or parasites. Common symptoms include frequent loose stools, stomach cramps, nausea, vomiting, and sometimes fever. The biggest danger is dehydration, so it's important to act quickly. Causes: The most common causes of diarrhea are eating unwashed fruits or vegetables, drinking unsafe water, poor hygiene, and sometimes infections from viruses or bacteria. That's why people often say, dirty hands are the stomach's worst enemy. Symptoms. Main symptoms include frequent water